All right, and welcome back. Now we are going to discuss a diagnosis that was recently added to the DSM-5, and I am referring to Disruptive Mood Dysregulation Syndrome, okay, or better known as DMDD. Think of this. This diagnosis was created because n- too many people were diagnosed as little kids between age 6 and really less than 18 or just about 18 years old. They were getting the diagnosis of mania or hypomania or something along those lines, right? And that wasn't really appropriate and it was creating a lot of trouble. So this is important because this diagnosis, you can use age as a discriminator to find the right answer. So let's go ahead and see what I'm talking about and discuss a little bit more about this diagnosis. My name is Dr. Lopez with ANP Exam Coach. So let's go ahead and see. All right. See here, I put the four children or adolescents younger than 18 years old kind of together so you can almost in series compare them and contrast. Right now, we are going to talk about the disruptive mood dysregulation disorders, followed by the intermittent explosive disorder, IED, uh, then oppositional defiance disorder, ODD, and finally conduct disorder. So pay attention to the next four lecture here and compare and contrast so you can see what how they are similar and how they are different. Okay. So first one, DMDD. This is the little bipolar kid. Okay, between often 6 and less than 18. Once they turn 18 and more, they can be diagnosed with bipolar, whether one or two, manic or hypomanic. But before then, if you ever get a question and they are saying, hey, these are the symptoms of bipolar, the kid is 12 years old, what is the likely answer? So you cross bipolar, it cannot be bipolar, okay? It can be DMDD. So think of it as the little kid with bipolar. Whoa. So what does it look like? Is a persistent, lasting, long-lasting dysregulation of mood. So depressive symptom, hypomanic-like, manic-like, but they cannot be called bipolar, right? The regular occurrence of intense tempered outburst or tantrums. Okay, so extreme and significant irritability. So irritability, it's a very common in kids, right, with this disorder, more so than you'd see one with bipolar. So it's very prominent for the younger age. Feeling of anger. Treatment options include the use of mood stabilizer, antipsychotics, and at times, carefully, very carefully, SSRIs, because we know that in adults, especially or teenagers, it can push someone into a bipolar like symptoms. Okay. So you want to conduct a screen for a family history of bipolar disorder. So if you see someone with this condition in this younger age, then you should conduct a family history of bipolar. They cannot ever be diagnosed with bipolar. They can be diagnosed with DMDD. Now, it can occur with other conditions, but let's take a look on this scenario. A children between ages 6 to 17 is diagnosed with depressive disorder after experience frequent intense temper outbursts, severe irritability, and feelings of anger. The child's healthcare provider prescribed a combination of mood stabilizer, antipsychotic, and carefully SSRIs, medications to help manage their symptoms. During the evaluation, the healthcare provider also screened for family history of bipolar disorder to provide a comprehensive understanding of the child's condition. Okay, I think you got the picture, right? So the mnemonic for this condition to help you diagnose the criteria for depressive disorders in children and adolescents between age of 6 and 17, you can use the mnemonics DICE. Okay, this stands for depression, irritability, a chronic dysregulated mood, episodes of intense tantrum outburst, and screening for family history of bipolar disorder, right? So, okay. Now, let's do a check on learning here. What age must a child be with a diagnosis of DMDD? Under 6 years old, between ages 6 and 10 years old, C, between ages 6 and 17 years old, or D, over uh, 18 years old, right? So that's pretty easy. We just cover this. Is the answer uh, has to be C, right? The correct answer for DMDD is diagnosed typically occur in children or adolescents between the age 6 and 17. Okay. So again, I just want to go back to the question. So here, question B, I mean, answer B, right? Between 6 and 10, it could be tempting, right? But always ask yourself which one is the best answer, just like nursing school. And this is what would look like severe recurrent temper tantrum. Okay. Irritability. So with that in mind, keep that what we mentioned. I just want to recap. DMDD disorder cannot coexist with ODD, uh, intermittent explosive disorder, or bipolar disorder. It can exist with major depressive disorder, ADD, conduct disorder, or even SUDS, right? For a patient whose symptoms meet criteria for both DMDD and ODD, which we are about to see next, should only get a diagnosis for DMDD. And then, the reason is that are we know that cannot be bipolar disorder, and if there is a uh mood dysregulation, it cannot be intermittent explosive disorders, and definitely cannot be ODD, right? So if it meets the criteria for DMDD, that's what you pick for your answer. If the patient has ever experienced a manic or hypomanic episode, right? So so that's what it would be like to pick, right? Now, we talked about the symptoms, and just another thing is to be mindful is the irritability, anger most of the days, nearly every day, and is observable by others, right? So, and that's it for this small little video. Now, let's go ahead and compare the other three children or adolescents conditions in which you should be aware of.